Hello friends, I am Dr. Sandeep Bhasin from Cosmetic Medical Center. Today I will tell you about some surgical details of a depressed nose or the saddle nose. As we discussed last time, that basic problem with the saddle nose is that the cartilage framework of this nose is very weak. We need to put something to increase the height, length and give a support to the nose. Normally we get it from the rib cartilage, and ribs have a cartilage part and the bony part. So we take a rib cartilage and put it in the nose to increase the height of the nose. This is called dorsal augmentation. There are few things that we need to understand that when we go into in-depth of this surgery. So normally what happens is when you get this surgery done of dorsal augmentation for the saddle nose, the immediate looks are very good, but after 2 years, 3 years, we have a lot of problems. And why these problems happen, let's understand that. Now one common problem what happens is, in depressed nose, the cartilage, entire cartilage is very weak. If we put a bone or a graft on top of that, initially the height of the nose increases, but with time, because the cartilage is very weak, this entire bone sinks down and the nose again becomes flat, it becomes depressed and it also becomes wide. So what need to be done in this case is that we need to support the cartilage that is present in the nose. How can we support it? There are various techniques. I will not go into a lot of details of it, but there is something called spreader graft, extended spreader graft or septal reconstruction. I'll show you the diagrams of these so that you can get some idea. When we put the spreader graft and we do septal reconstruction, we give strength to the basic cartilage that's underlying, and then when you put a graft on top of that, it gives a support to this cartilage, and the cartilage will not sink down, it will not come down with time. Otherwise what will happen, when we do this surgery, with time this dorsum will again sink down. That is one common problem. The second common problem that is very common and that we must know, as I was telling you that we use rib cartilage for this dorsal augmentation to increase the height of the nose. Now what is a common problem with the rib cartilage is that with time, after a few days, this cartilage starts bending. This is called warping of the cartilage. If we have not taken care of it while doing the surgery, so we have to basically do is split the graft into two, the rib cartilage into two, and then turn them in the opposite direction and force and then stitch them so that the graft does not warp. It is counterbalanced by each other, by opposite polarities. If we have not done this technique while the surgery, the graft can bend after a few days and it will look very odd later on. So warping of the graft is a very, very common problem. Now third problem, that what common mistake done is that graft is put, the dorsal augmentation is done, but the length of the nose is not elongated. So we increase the height of the nose but not the length, then the nose does not look good aesthetically. To increase the length of the nose, we have to do special techniques that we called septal extension graft and columnar stud graft. They can be used, they should be used to increase the length of the nose along with dorsal augmentation. So not only the height or the projection, but also the length of the nose is increased in a proportion so that the nose looks aesthetically good. The fourth common mistake that's commonly done is that many times, to make the surgical time short, what is used is a silicone implant. So with silicone implant, what happens? The surgical time comes down. Normally we take 5 hours, 6 hours to do this surgery. But when we use silicone implant, the whole thing can be done within 1 hour time. And what happens when we do a silicone implant? The immediate results are very good. But with time, after 1 year, 2 year or 3 year, this implant can get infected, it can get dislocated, it can go. It's a foreign body in your body. It is not something natural. So these problems can happen. So friends, if you are going for dorsal augmentation, all these things have to be very well understood. The right technique has to be used. So not only the results are good, results are maintained for a long time to give you adequate results. Thank you friends. I am Dr. Sandeep Bhasin from Cosmetic Medical Center.